Hi guys, Professor Novak here. So we're going to talk a little bit about the arterial line setup. You will need to know how to do this. You will learn this in the lab, and then during simulation you will also probably have to set this up. Okay, so we know that we're going to use our arterial line for blood pressure monitoring. We know that we can draw labs off of it, arterial blood gases, things like that. It's a fairly easy setup, but we do need a couple of supplies, okay? So before I start, I'm gonna wanna make sure that I have a pressure bag, okay? This is a 1000 bag, which means I'm also going to need a 1000 bag of 0.9% sodium chloride. That is the only bag that we can use, the only fluid we can use with that pressure bag, okay? Then I'm going to need my pressure tubing. You'll know it's A-line tubing because it's going to have the phone jack cord attached as well. And then you're going to need a transducer holder, which we are going to put on our IV pole in a second. And then we don't have this in the lab, but in real life, you would need the actual cord that hooks up from the arterial line to the patient's monitor, okay? So you remember there's three principles that we really needed to understand with setting up the A-line, one of which is the leveling portion. Remember, we want this transducer holder to be level with the patient at the fourth intercostal space in the mid-axillary line, also known as the flevostatic axis. So on our IV pole, I'm going to set this here. And this is flevostatic for the lab, so we're just gonna go with this, okay? Okay. All right, so now that I have that ready to go, I need to get my tubing primed. Remember, I don't wanna put the bag, the IV bag, inside of the pressure bag and then inflate the pressure bag and prime my tubing. I want to prime my tubing with gravity beforehand, okay? So remember, the bags in the lab have been spiked before, so be careful with those red caps. They like to pop off. I'm going to take my red cap off. And your tubing set has probably been used a few times before, so you're more likely to get some more air, but we're gonna go with what we've got here, okay? So the one that I have here has the extension set separate. So remember, when we're looking at this tubing, looks just like IV tubing, with the exception of there is a transducer on here, and that is where the magic happens, and that's how we get the numbers that we want. And then the extension set just gives us a little bit more room from the transducer to the patient, so that way we have a little extra room to work with. So I want to make sure this is all attached, okay? Before I spike, I'm going to close my roller clamp. I'm going to say there is a sterile end cap on this, even though there isn't. Spike my bag. Now that I've spiked it, I can put it up on the pole, okay? Now, before I prime this, I want to pay close attention to where my stopcocks are, okay? And this tubing likes to get tangled, so bear with me here. I want all of my stopcocks to be off to air, so that way I can prime my tubing in line, okay? So I'm going to check my stopcock at the transducer, which is off to air, and then I'm going to check my stopcock closest to the patient. I'm going to make sure that's also off to air, okay? Now I am ready to prime. So I'm going to open up my roller clamp. I'm going to squeeze my drip chamber about halfway, and I'm going to notice that the flow actually stops, okay? So the flow stops because this is pressurized tubing. So remember, in order to prime this line, we need to flush the line, just like we do once it's attached to the patient, okay? So in order to flush, I'm gonna look down here by my transducer. This is either going to have a pull tab where you flush or a squeeze tab, okay? And that is what I'm gonna wanna use to prime my tubing, okay? I'm gonna go ahead and give that a squeeze. Okay. And this tubing has seen better days, so this is definitely going to give me a hard time. But you get the idea. Remember, this is going into an artery, so when we teach you not to have any air in your IV tubing, that's important, but it's 10 times more important when it's going into an artery, okay? So we really, really wanna make sure that we purge this entire line and make sure that it is free of any bubbles, okay? Once you've done that, and we're gonna say that I've done that, once we've done that and we have our sterile end caps on the distal end, we're ready to place our pressure bag, okay? Now we're ready to pressurize this. We like to keep the label of the normal saline on the outside of the bag. That way other nurses can verify that it's 0.9% normal saline and not anything else that it shouldn't be. So you're gonna take this off the pole. And if you notice on the bag here, there is a little hanger, okay? I am not the most coordinated individual sometimes, so I actually place my hand through the bag and grab the bag from the bottom to pull it through. Okay. Once I pull the bag through here, I'm gonna wanna use that little notch to hang up my bag inside of there, okay? It's like a little IV pole inside of the pole, okay? Once I've done that, I can come back over to my pole. Remember, we need to pressurize this to 300, and we will see that green notch light up here, okay? There's a stopcock on this as well. You guys know how to use the stopcock. If you don't, there's separate videos for that. But we are going to inflate this to 300. And we're gonna get an arm workout in the process. So, looks like I see some green here. Okay, so I'm at 300, which is what I need to be at. If I leave the stopcock where it is slowly over time, this bag is going to leak air out. When this bag is not properly pressurized, we don't get the correct numbers, okay? We could be titrating pressors to a blood pressure that isn't even accurate, okay? So it's really, really important that we make sure that our entire circuit is set up properly. So in order to avoid air leaking out of the bag, I'm gonna turn the stopcock up, so that way it cuts off flow from the bag, okay? I can see my normal saline on the outside. My tubing looks really good. Now I'm ready to put this on my transducer holder, okay? We're gonna say we've already leveled this with the patient's phlebostatic axis, okay? Now, for these ones in the lab, they do have little tabs on the side. Remember, arterial is always going to be red, PA catheter is gonna be yellow, and CVP is blue. When I'm hanging this up, essentially, I want the patient side to be up, okay? So if I take a look at this here, because some of us need to actually visualize before we attach things to patients, like myself, I want the patient side to be up, okay? So that way when I'm doing all my calibrations, I'm leveling, zeroing, flushing, all of that, I want the patient side to be up, okay? So I'm gonna slide this in here, almost like a little seat belt, okay? So that's attached there, okay? Now remember, my physician is putting in the line, so this all needs to be set up before the line goes in. It's just like an IV catheter, just like how we attach the J-loop. When the provider gets the line, that line needs to be attached directly to this circuit immediately, okay? There is a clamp on the line, so they can clamp the line and wait, but they're not gonna stand there and wait for you. So this needs to be set up before the patient's line goes in, okay? So my patient side is facing up. My phone jack cord needs to get plugged into the monitor, okay? So in the lab, we don't have that capability, unfortunately, but in real life, this would be where you attach your phone jack here, and then you attach this to your monitor, okay? Once that's attached to your monitor, you're going to have nothing, no waveform, okay? And even if you attach this to the patient, you might get a waveform with no numbers, or maybe you get numbers with no waveform, vice versa. What we need to do at that point is we need to zero the line. And whatever your facility's policy is on zeroing the line, just remember that every time you use the line, or if you have uncertainty in the numbers, or if you move the patient, you should be zeroing and flushing that line to make sure that your numbers are accurate, okay? Because you might have really nice numbers, but the waveform's not looking so good. And we want that nice dichrotic notch, we want those nice waves, so we are going to zero and flush the line next, okay? So let's say in my hypothetical patient, I'm going to pull over here. Let's say my provider got the line in. Yay, very exciting, okay? Now, this patient, we're gonna say that this is a radial line, okay? And with this, remember, there is this special little device that's really nice if you ever see these in the hospital. This is an arterial hand aid starter block. Okay, that's a lot. So what this does is you can actually take the patient's wrist and you can place it inside of this holder. And this will keep their wrists nice and flexed, so that way we get good flow through the artery and we get good numbers. Sometimes when patients start to flex their hand, you're gonna see variations in that waveform. And again, we don't wanna be titrating pressors to a wrong blood pressure. It's really dangerous, okay? So let's just say this guy's got an arterial line in his radial artery. At this point, I'm ready to connect to my patient, okay? So same technique, we're gonna scrub our hub, we're gonna attach our A line, okay? Once we're attached, remember our monitor needs to be zeroed and calibrated. Remember, when we zero, that's the calibration, okay? That's where the transducer is able to take atmospheric pressure from the air and calibrate this line to actually augment or give us a blood pressure for the patient, okay? So what does that mean exactly? Let me bring you a little closer. So what we're going to do is, remember, we transduce at the transducer. This is where I'm gonna do my zeroing and my calibration, okay? And remember this saying, because this is what's going to help you even in the future. I still say it, and I've been an ICU nurse for almost 6 years. So we wanna turn the stopcock off to the patient, okay, which is going to be up in this case. And this end cap here, I'm gonna take that off to air, okay? Now, what this is gonna do, and if you're looking at the monitor, it's gonna be flat. You're gonna see a flat waveform. It's allowing the transducer to pull numbers from the environment to complete the calibration, the zeroing, okay? So on our monitor, we would hit 0 arterial line. It's going to give us 2 beeps. It's gonna say arterial line zeroed, okay? While I'm maintaining sterility, I don't wanna lose this cap, okay? In the real world, we put a fresh cap on. In the lab, we don't. You're gonna take your cap, put that back on. You're gonna turn your stopcock back off to the air where it was originally, and you're gonna give this line a big flush. So you're gonna squeeze that flush tab, squeeze, squeeze, squeeze as hard as you can. And while you're looking at your monitor, you're gonna see that square wave test, okay? Square wave, then you'll see some oscillations, and then hopefully you get your numbers, okay? The zeroing and the flushing is pretty concurrent, okay? If I was drawing labs off this line, I would wanna flush the line first to clear any blood or anything that might be in there. And then I would want to zero and flush the line to kind of complete what I need to do for the patient, okay? So very simple setup. In your simulation coming up, you will likely have to set this up. One of the groups will have to set up an arterial line for a patient that probably is going to require pressors. So make sure you get comfortable with this. If you have any questions, feel free to reach out to me, and we'll see you in the lab.